briefly, and because of their ages, they were told, no, you can't have this. And I say, well, that's really not, they weren't pleased with that, and my feeling is that's not a decision that a doctor makes for somebody else. I mean, that's a personal decision based on the concept of informed consent. So that's how we got it, and then I suggested, well, we talk a little bit about it, because to me that's a really important issue. And informed consent is not just signing a piece of paper. Somebody sticks a paper in front of you, you sign it saying you agree, but it's really, a process that begins when somebody calls or starts to seek information. So, we try to provide very comprehensive information about everything that we can think of that's related to the ligation reversal. All of the pros and cons, how it's done, what are the various options. I mean, like in terms of the surgery, there are various types of surgical procedures, alternative treatments, which generally, involves in vitro fertilization or some variation of that.
Your website's excellent. I mean, it really is, as far as finding out. And I'm a researcher. I'm somebody who will read something to death before I make a decision to do it. And you do offer a lot of information on your website. And then everyone's very knowledgeable too. And so when questions did pop up, it was very easy to get that, have my questions answered. And,
excellent.
Even at home, if I think of something, oh my gosh, then it was easy enough to either find it on the website or find somebody that could answer it. So that was, and that's being accessible too. That's a very good thing.
We try. I mean, that's pretty important. We have nurses, generally 2 nurses. Well, during working hours, I mean, we have a lot of nurses who work here, but outside of working hours, we always have 2 nurses carrying cell phones in addition to myself. And I try to be readily available by email. I check email every day, multiple times throughout the day and evening. But it's interesting to me too, like, you're here, this is now, we're sitting in the 2nd stage recovery room, and I think I finished your operation around 11 o'clock?
11:07, I believe she did.
11:07, and it's now 12:35, so, this is within an hour and a half of surgery. And I think one of the things that's important to me that I really try to ensure for patients is that not only is the surgery safe, but to do everything I possibly can to make it so that it's comfortable. Because one of the worst things about surgery, is that it can be very painful, and that's one of the disadvantages, of a surgical procedure, and the recovery time, that it takes. So I find it interesting, and the reason I just asked if you'd be willing to talk about it, just your perspective on things is, as a neonatal intensive care unit nurse, you're seeing things from both the patient's perspective, and then you obviously have, the nursing professional perspective on healthcare. So.
One of the wonderful things is all the pictures that you have in the books, and you're waiting, for people who are, wondering, are these results that I've been reading, are they real?
Yeah.
Well, there they are, right in the books.
Wow.
You can see that, and that's a great thing. So it really boosts you up a little bit. So.
I mean, that's the joy of the whole thing. So obviously we want to follow up. We want to know, I mean, there are various reasons for doing it. And when it comes back to the issue of informed consent, frankly, I don't see how anyone could undergo tubal reversal surgery with fully informed consent unless they have a realistic idea of what the success is going to be. I mean, that's, again, what are the potential benefits, what are the potential risks? Well, if we don't follow up on all the patients who had surgery and find out what the outcomes are, how can we provide that information? And I don't know how to say it, sad thing or kind of disgraceful thing is that no one else does this. It does take a lot of effort, admittedly. You know, you have to be committed to maintaining that contact, which is different than most surgical procedures where, you know, once the patient's recovered from surgery, they're no longer a patient.
Right.
But to me, it's the only sensible thing to do. And it's exciting to know what's happening intellectually. It's gratifying. It adds useful information, I think, you know, to the medical field, but it's absolutely essential for patients when they're trying to
Absolutely.
decide what to do. If they don't have that, how could they really decide between, you know, IVF or tubal reversal or to go to this place for tubal reversal or someplace else?
Right.
So these things seem just sort of
And it makes you
common
decide, is
sense.
it worth it to do this? The first question everybody asked at work when I went to work and told them what I was doing was, okay, what's the chances that it's gonna work? What's your likelihood? And I was able to give them that information because I'd gotten that information, you know, it was right there on the website, plus after speaking with you, you know, and no, I mean, everybody's situation is a little bit different. I'm sure every patient that comes through your door has a little bit different scenario and why they chose what they did and what's going on in their life. And, you know, you're right, informed consent, you know, it is a very personal thing, you know, will it work for me in my particular situation, you know? And what are the benefits and what are the risks, you know, involved to me if I do this, not just physically, emotionally and everything else. It's a big undertaking for anybody.
Mhm.
And I really do feel like I was very prepared, you know, by you and your staff and the website for it.
How about what do you think about it
The
on?
full disclosure of knowing both sides of it, it's not a used car sales pitch. It's here's what we offer, here's the good, here's the bad. Make the decision on your own. There's no sugarcoating of any of the thing to get business. It's,
Mhm.
you know, you definitely bring off the impression of well, you want people to come in knowing what they're getting into and are completely aware of every aspect of it and every side of it.